Welcome to a special Best in Dental Care episode of Care Experts. We've put together the most popular and talked about episodes of the year. We'll be covering clear aligners and root canals with Dr. Kellen Mori, and dental implants and tooth extraction with Dr. Daniel Naysan. Let's get started.
So what exactly are clear aligners and how do they work?
Clear aligners are a type of orthodontic treatment. They are used to straighten your teeth and also to correct various bite issues. They are an alternative to traditional braces, and they consist of a series of clear trays. They are custom made to your teeth, and they are worn 24 hours a day, pretty much.
So how long on average would it take for someone to, say if they're using the clear aligners, to get the results that they wanted?
Each case varies because it depends how crookedness you have and how many misalignment and how the teeth are positioned. So each patient has a different treatment time, and it can vary between 6 to 12 months.
So how do clear aligners work versus braces? Are there advantages to one over the other?
So clear aligners, they work through the same concept. You are moving teeth, applying force, right? So clear aligners, they have customized trays that you use, and every 2 weeks you change to a different one. So the amount of pressure, it's more gentle than regular braces. So regular braces, you have brackets and a wire that goes across your teeth.
Okay.
So this force is more controlled. So braces work all the time. And clear aligners, they will only work if the patient is compliant and will wear the trays for 20 to 22 hours a day.
Thank you, doctor.
Now let's hear what Dr. Mori has to say about root canals.
So Dr. Mori, can you explain to me what exactly is a root canal?
Root canal is the treatment of the infected pulp, nerve tissue, blood vessels, and other cellular entities that are inside your tooth. So the tooth has like layers, so the enamel, the dentin, and then the nerve. So the nerve is, when you do a root canal, this nerve got infected by bacteria.
So how would a patient know that they need a root canal?
So when you need a root canal, you're gonna have a lot of pain.
Okay.
Usually, it's not like, oh, I think I need a root canal, my tooth is hurting. It's not like that. It's a very, very distinct pain. It's almost like a throbbing, like your heart's beating inside your tooth. Wow. And it started by a simple caries, a simple decay, but you neglected. You didn't go to the dentist. That decay started getting bigger. It went from the enamel to the dentin. Now it's in your nerve. And there's no way around it. You cannot cure that at home. So you need to go to your dentist and have a root canal.
Okay. And what are some things that patients can do to prevent ever having to have a root canal?
The best prevention is to go to your dentist regularly, because a small cavity can be taken care of with a simple filling. But if you don't go for checkups, if you just neglect, you're going to need a root canal. And a root canal, you need a crown, and that's much more costly.
Thank you, doctor.
It's time to talk dental implants with Dr. Daniel Naysan.
So what exactly is a dental implant?
So a dental implant is made up of a titanium screw that goes inside of your jawbone and is used to treat missing teeth.
And when or why would someone need a dental implant?
So when you lose a tooth, unfortunately, to a fracture, crack, or you have an infection, you lose a tooth, implants are a great option at restoring that tooth.
Can you walk us through exactly what happens in a dental implant?
So right now, the great thing is we can do a lot of our procedures with a CT-guided stent. Okay. So what that is a CT scan can determine, based on the location of where it's best to place the implant, make a stent, which is something that goes inside that person's mouth. And we can basically drill a hole into the jawbone and integrate that implant into the jaw. And that goes in, and it needs to be there for about 4 months until it integrates. And then you could put the crown that goes over that implant.
So how long does this whole procedure take from start to finish exactly?
So the first visit, which is the actual implant, usually can be done in less than half an hour.
Okay.
You wait 4 months, and then you come back, and it's a 2-visit procedure. So you come in, you basically uncover the implant, put something in it to take an impression. That impression is sent out to a lab, and lab makes the crown. It comes back, and we put the crown into the person's mouth.
Okay. And how long do implants generally last?
A lifetime.
Okay. So it's not something like you get it done, you need to come back in 5 years. It's once you have this implant, it's good for life.
Once it's done properly, it should last you for the rest of your life.
Thank you, doctor.
Here's more from Dr. Naysan about tooth extraction.
So can you tell me, how do you know exactly when a tooth needs to be pulled?
Usually there's a rule that dentists follow. And if there's not a specific amount of tooth structure over the gums, then the prognosis of that tooth is going to be poor. So in those cases, we pull the tooth.
So is there something that would have happened to cause this? Is it just is it trauma, or is it just poor care?
Usually it's a combination of everything. You're talking about deep decays, you're talking about vertical root fractures, you're talking about failed restorations. So in a lot of cases, we try to avoid it, but once the damage is done, there's nothing you can do and you got to pull the tooth.
And what exactly is the process of extracting a tooth?
So it's a one appointment procedure. Patient comes in, gets local anesthetic, and basically it's just a little bit of pushing the fibers away from the tooth structure where the bone is and using a forceps to kind of pull that tooth out.
So it sounds painful, but is it generally painful?
It is not.
Okay. And I'm assuming that the patient would be fully under, or is that something that you can opt to choose?
No, they could be awake, just under local. A lot of, I would say at least 90% of our patients that come in get it done under local anesthetic or some type of nitrous sedation.
So what kind of aftercare would you recommend to a patient after they've had a tooth extraction?
So one of the most important things after an extraction is done is not to cause any negative pressure in that socket. So drinking through a straw, spitting, smoking, those are things that can break the clot up and cause a lot of pain afterwards and doesn't allow healing of that socket.
How long do you have to adhere to these things before it heals?
At least a week.
Thanks for joining us for this special Best of Dental Care episode of Care Experts. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.
Thanks for joining us on Care Experts with CareCredit. If you enjoyed this episode, please subscribe and share with friends and family. And stay tuned for new episodes every week. All information, opinions, and recommendations discussed in this episode are for your information only. We believe the information sources are generally reliable, but because of possible human or mechanical error by the sources, Synchrony or its affiliates, including CareCredit, does not provide warranty to the accuracy, quality, or completeness of the information or any results obtained from it. Any statement or opinions in this episode are the doctor's alone, and included data was current to the time of creating this episode. Please consult your own advisors before using any of this information.